Hi, everyone. Welcome to the webinar, Understanding the Runaway and Homeless Youth Crisis in Native American Communities. I'm Rachel Reynolds. I'm the Outreach and Prevention Specialist at NRS, and we're also joined here with some really great panelists today that I'll introduce in a bit. Just some housekeeping that we'll have time for questions for everyone to ask at the end, and the panelists will be able to answer. And if there's any technical issues that you're having, I have Lee Osipchek, the Director of Training, Education, and Prevention with me to answer anything urgent in the chat or question box, so feel free to ask that. Otherwise, we'll leave everything to the end. And also, just an FYI to everyone that has tuned in, we are also recording this too. So here are some items that you'll be able to walk away with after this webinar. One is to understand issues faced by Native American youth in their communities. The second is to learn about resources and services provided by leading Native American youth serving organizations. And then finally, be able to integrate culturally competent approaches into youth services. So a little background on the National Runaway Safeline, kind of why we're hosting this and having this webinar today. We're the federally designated national communication system for runaway and homeless youth. And our mission is to keep America's runaway, homeless, and at-risk youth safe and off the streets. And each year we make approximately 100,000 connections with youth and families through our hotline, online, and offline resources. So then also at NRS, we're in a really unique position to tackle runaway prevention and be able to help youth because over 50% of the youth that are contacting us are still at home and are not yet on the streets. So we offer the following intervention and prevention services. One is to connect youth to community resources and support. So youth can contact us through our hotline number, our email, forum, or chat, and depending on what they need or want, we can connect them with resources and services in their area from our database. Our employees and volunteers are trained to use our crisis intervention model in which we problem solve with the youth that are contacting us. Youth can also gain access to our Home Free program, which is where we partner with Greyhound and grant free bus tickets to youth that have left home but want to return. And then finally, we serve as a listening ear and are really there for youth that are in need and need someone to talk to. And another thing to note is that we also support communities and organizations in different awareness and prevention efforts. And we do this by having an educational blog where we highlight the issues runaway and homeless youth face and also the resources that are available to them. We have a free runaway prevention curriculum that's 14 modules, and it covers a variety of topics like anger management, communication and listening, and this curriculum helps youth develop and learn specific life skills that can help mitigate a run episode, and also they'll learn how to connect with different services. So this is free, this is on our website, and it's just different modules and activities you can do with a classroom of youth, with just one-on-one, kind of in a lot of different settings. And then finally, every year we lead a National Runaway Prevention Month awareness campaign. So before we hear from our panelists very soon and hear about the unique ways that they serve runaway and homeless youth in Native American communities, I first wanted to talk about the magnitude of the issue. So this is data from Chapin Hall, and it shows that 1 in 30 adolescent minors and 1 in 10 young adults endure some form of homelessness in a year. And this can include running away, being kicked out, and couch surfing. And these are statistics just kind of highlight why runaway prevention is really important to us. And now just to touch upon RHY issues in Native American communities before, again, we hear from the panelists who are really experts on these issues. Numerous studies have shown that Native American young people are overrepresented among the homeless youth population compared to the general population of youth and are disproportionately impacted by these issues. And again, a study from Chapin Hall shows that American Indian and Alaskan Native youth have more than double the risk of homelessness when looking at other youth in other communities. And as we know, RHY youth are vulnerable to human trafficking. So these statistics, along with a lot of different studies, show that RHY Native youth are at a risk for human trafficking. So now we're going to hear from our panelists about the youth that they serve, the work that they do, and then we'll wrap it up with a panel discussion and then turn to the audience, the attendees, and have some time for you guys to ask some questions as well. So today we're joined here by the Ain Dai Young Center, Maggies House, and also Evergreen Youth and Family Services. Unfortunately, the Center for Native American Youth got pulled away today and can't join us, but they said if you do have any questions that are specific for them, feel free to contact me and I can forward them to them, the questions to them. So first, we're going to hear from Angela. She's the Associate Director of the Ain Dai Young Center, and she started in 2008 as a Ramsey County Children's Mental Health Case Manager, and from there she became the Director of Children and Family Services. In 2015, she moved to the role as Residential and Clinical Director, and during her time in the role, she became instrumental in the implementation of the Ramsey County Coordinated Entry System and policy work to ensure that people have access to culturally specific housing services. And then in June, Angela became the Associate Director and will be overseeing the new supportive housing project. So I'll give the floor to you, Angela.
Yeah, hello. Ain Dai Young Center has been operating in St. Paul since 1983. It started as a shelter for youth that were experiencing homelessness at a school that was in the neighborhood, the Red Schoolhouse, that was in place to serve Native youth. And when they realized that there were attendance issues and the level of homelessness of their students, they opened Ain Dai Young as an emergency shelter for its youth. That program, like I said, had been in place since 1983 and served youth ages 5 to 17. A good portion of the youth that we have are experiencing out-of-home placements through child protection, and then other youth are just self-referred because they have run away or are homeless. We know that youth that are entering child protection and in foster care have high rates of homelessness into the system later. So it's important for us to be there early on to support those youth and hopefully offer the services that they need at that point to support family reunification. We also offer transitional housing services for youth ages 16 to 21. We have a street outreach team that is really just in all of the communities, trying to find the youth where they're at. They operate from a harm reduction model, just making sure that they get housing assessment, all of the supplies that they need. And then our prevention programming, Nini Johnny Sug, which is, as you can see, focused on the chemical dependency, tobacco prevention, suicide prevention. And they work with youth ages 18 to 24. We also provide a lot of Indian child welfare advocacy in the courts with families, children's mental health services, and then in the next couple of weeks, we will be opening our permanent supportive housing, which will be 42 units for Native youth experiencing homelessness. The emergency shelter, as I was saying, has the 10 beds. It historically has, served 100 or so youth a year. An emergency shelter is supposed to be a short stay. It was typically about a 21-day for our average stay. Unfortunately, or fortunately, I'm not sure, over the past couple of years, we've had increase in our length of stay, which you can see now is 63 days. that is a lot due to not having services in the community on the back end after youth are transitioning out. So we have a lack of appropriate foster care placements in our community, and so youth are staying longer and longer times in emergency shelter. Over the past 4 years, it hasn't been uncommon for us to have youth in emergency shelter from anywhere from 6 to 12 months, which is a long time. So that has been increasing our length of stay. Our transitional housing, that's the 6 beds, is filled through coordinated entry, and we typically serve about 13 clients. And our outreach, as you can see, has a high contact with youth, and they play a really important role in making sure that Native youth get the services that they need and the housing assessments to have access to shelter and housing. Our Nanny Johnny Slug program is out in the community a lot. They work in some of the schools as well as with all of our programs. And then our ICWA court monitoring, we're one of 2 court monitors in the nation, and they are monitoring for compliance. And again, that's really for prevention, to make sure that the families are getting the services that they need. And that partners with our Nokomis Circle Child Welfare Liaison and our Family Advocate. And Children's Mental Health is providing supportive services to families with children who have severe mental health needs.
Great. Thank you so much. Was there anything else, Angela?
No, I think that is all.
Great. Thanks. We'll hear from you a bit during the panel discussion then.
Absolutely.
So now we're going to hear from Pauletta Red Willow. Pauletta currently works with tribes on RHY and trafficked youth and has been at Maggie's House for 11 years and the Oglala Sioux Tribe Shelter Director for 11 years as well. And she also was a YouthWorks nonprofit member. So I will give the floor to you, Pauletta.
Ampatuwashte, everyone. Thank you for joining. I operate Maggie's House. I'm the director. We've been in operation since 2008. We're one of the only transitional living programs located on a reservation in the country. We have recently acquired another building so that we can be doing some human trafficking for youth in Indian country, and we partnered with
Pauletta? It sounds...
Is that me?
Yeah, wait, so now it went away. I think you're good now. Wait, no. Kind of... Okay, I think it's good. Sorry about that. I don't know what it was.
Okay. And so we'll be opening a human trafficking building for Native youth. My next slide. Okay. The scope of services that we provide, we have residential care for youth ages 17 to 21, and we're modeled off of the Family and Youth Services Bureau's Transitional Living Program. So we have a 22-month residential time frame for our clients. We provide workforce development, educational, behavioral health, substance abuse, physical, dental, vision, and hearing screening and assessment. We do case management. We also do referrals to behavioral health professionals for our clients who need specific services. We do substance abuse assessments and treatment referrals. We have elder mentoring, peer-to-peer mentoring, cultural mentoring, cultural parenting. We do driver's license classes. We provide transportation and funding for clients who are trying to acquire their driver's license or need a state ID or tribal ID. We have an elder mentor program, and they come in and work with the clients and do traditional foods and cooking, cultural activities, how to make tobacco ties, what the sweat lodge is for, different things like that. And then we also do critical document collection for some of our McKinney-Vento clients who have no access to any of their birth certificate, social security number, immunization, things of that nature. And then we do specialized case management for some human trafficking youth that we have encountered. And so we use a lot of our Lakota culture in the environment here at Maggie's House. And so we are lucky to have a board of elders that come, and we have an open style board meeting with all of the clients present, and they're allowed to contribute and provide direction as to programming the needs and wants of their youth and their community. So one of the activities that we're working on developing is an LGBTQ open meeting here at the facility. And so thank you all for joining, and I'm happy to be a part of the panel and answer any questions you might have. Pilamia.
Great. Thank you so much, Pauletta. So now, last but not least, we're going to hear from Gary from Evergreen Youth and Family Services. He's been at Evergreen for 25 years, and his education and background is in criminal justice, social work, and theology. He's been working with at-risk youth for over 30 years, and prior to Evergreen, he worked in a residential treatment center for 7 years. So I'll turn the floor to you, Gary.
Well, thank you. Hello to everyone. Yeah, we've had a shelter in Bemidji since 1977, and it started where there was a group of people in the community were worried about youth in our community that were running away. It was the 70s. They were smoking entirely too much marijuana and getting into trouble. So they envisioned having some house where adults could get a hold of these kids, kind of find out what their needs are, see if they couldn't address some issues and make a difference in their lives. And so that became the shelter, and now we're in a different location. We serve 300 or more kids a year that come through the shelter. We're between three of Minnesota's largest reservations, so half of the youth that stay at the shelter are Native American. Most the youth are Ojibwe. We get some Lakota, Dakota, Nakota, but primarily Ojibwe youth. It tends to be short-term stays, and a lot of it can involve child protection issues, or it can be just the sort of kids that are worrying their family's sick because they're running away, getting involved in drug subculture, that kind of thing. So we just try to be hugely helpful, and we have multiple services now. We have another site where we do trans housing, independent living skills, street outreach, just a variety of kind of wraparound services. Let's take a peek at the next slide. Oh, see that mural? We do a little bit of artwork here, so that's kind of fun. That's a youth that's running away from adversity in their life, but you have a sense that they're determined and that they're gonna reach the shore. They've got some of that intensity. So that kind of describes a lot of kind of the situations that kids are in that bring them to the shelter. So we try to create a real warm home away from home sort of atmosphere. We're more of an attention facility than detention facility, and work real hard on having staff that are very relational, that make kids feel at home. But I'll get into a little bit of more of that later. What else do you have for me? A slide.
This is the last one before
Okay.
the panel.
All right.
Great. Well, thank you so much to our panelists. Now we're just going to ask a few questions. Then after this, we'll make some time for attendees to ask questions. But the first one for our panel is, How does your organization incorporate Native traditions which can help youth heal while providing RHY services and other programming?
This is Angela from Ainda Young Center. That obviously was the premise of Ainda Young when it was created, was to have a place that was created by the Native community for the Native community. And so the goal is to have culture and traditions like interwoven into all of our practices. The goal is to have, like, for our Native staff and non-Native staff to always feel comfortable in incorporating the culture and traditions into their work. And so it can look a little different depending on the staff and their comfort level. But some of the stuff that we have is, like, our outreach workers, for example, carry smudge kits and medicine bags for the youth when they are out. All of our sites have medicine gardens that the youth help to care for and to harvest the traditional medicines to use. Our Nini Johnny Sug program is prevention work all through culture. And so they take youth to ceremonies. We host ceremony here. They do drum and dance. This summer, they are ending a 5-year documentary project of taking youth across the country to different ceremonies. They went to different reservations and interviewed people, and they are putting together a documentary of all of the work that they're doing for youth leadership. We partner with elders in our community to come in and teach. We do, like, family nights once a month, so elders will come in and do storytelling, and we do drum and dance and different crafts. But the new site that we have, it was really important for us to have really clearly Native space and program in St. Paul. And so the development of the program was done in partnership with a youth panel and a lot of feedback from the community. And so we're fortunate that we were able to have a sweat lodge on site. We'll have medicine gardens there. And we have a cultural activity center that will be in the basement that will have the ability for us to host darkroom ceremonies there. Also, it'll have everything that they need to be able to make regalia for beading. There's a room attached that they can process the hides that they need to be able to make drums on site. So we're just trying to integrate it into all aspects of our work with youth, whether they're on the street or in our housing. The other thing is it's important for us to bring families in, even when we're working with homeless youth. A lot of the time, you know, I think in homeless youth services, we have access to the youth, and it's sometimes more difficult to engage with families. But that's why it's important for us to host our family nights so that the parents are also having access and to the culture and traditions and learning, so that it becomes more a part of the family and that we're not just giving those things to the youth.
Mm-hmm.
I guess I think at Maggie's House, this is Pauletta. We're fortunate that we are located in the heart of the Pine Ridge Reservation. And so our clients have a lot of access to local activities that involve our culture. There's powwows in our community or outlying communities that they're able to attend. We have a board and elder mentors that come in monthly, and we're able to interact and visit with the clients. We have a really open atmosphere, and we have volunteers that come in and provide different activities for the clients, like life skills, development curriculum we use is the Native American based life skills. So we're able to tie culture and life skills together, and then seeing firsthand the living situation on the reservation and how we're able to develop certain set of skills to cope and deal with life on the reservation, and seeing the volunteers and staff maneuver and function in their daily life on the reservation really has value to the clients, because some of them don't want to move off reservation, but with the housing struggle and the poverty and the lack of jobs, they learn through the staff and volunteers how you're able to raise a family and to live on the reservation and develop those connections with your community members and your extended Tiwahe and Tioshpais, which is your family dynamic. And they create relationships within the community that help them incorporate themselves and become community assets. So ours is more of a holistic type of living situation where we incorporate the culture. And I know that's beneficial to us living on the reservation versus what my colleagues are doing in the city, which I really commend them for reaching out. We've done outreach in Bismarck with YouthWorks, and we're developing programming within the school systems to incorporate culture in a city-based environment, and taking some of the teachings that we've done here on the reservation-based program and trying to implement that in the city-based setting. And so right now we're cultivating and working on some adult mentors and elder mentors in the city setting. And so we're going to be using our elder mentors from here and having a meeting in how to implement that locally.
Mm-hmm.
Hello, this is Gary again. Our program is a little bit different, perhaps, where we have some federal and state rules that we have to follow. So we're limited in some areas. We try to do a pretty good job trying to find out when youth come in what their cultural and spiritual needs are, but our rule doesn't allow any of the staff to participate in any overt religious activity, but we try to make sure that we keep kids connected. And so if we have youth that are Medewan or traditional, we do have medicines in the shelter, and youth can smudge, use tobacco, and we try to make sure the staff are trained so they know how to help youth feel comfortable. And then we try to facilitate their access to spiritual mentors. We have a volunteer medicine man that comes from Red Lake and does cultural teachings and ceremonies with youth. But we have to walk kind of a careful line there. We do try to incorporate all sorts of different cultural events so that kids, wherever they're from, are finding a good source of expression, and encouraging kids to develop their cultural identity and their spirituality, because we know how that important is for your identity and your sense of self and self-worth. So it might be a little bit different than some of my colleagues here that have real culturally specific programs.
This is Angela from Young. One thing I just wanted to add is, with our location being in St. Paul, one of the challenges for us is that our youth are coming from a lot of different communities. And so, I mean, primarily we're working with Ojibwe and Lakota, Dakota youth, but we also have youth from like Ho-Chunk youth from Wisconsin. We have youth that are First Nations and from, tribes that are across the country. And so for us, when we're like working with the youth, it's and the services that we provide, a lot of times it's based on the practices and beliefs of the staff that we have, but then we're also working always to try to make connections with people from other communities so that youth have those direct connections back to their home community. But we're having to, try and integrate culture, but also, understand that all of the youth coming, that their traditions and beliefs may be different from those of our staff. And so we're trying to navigate that a lot with them.
Mm-hmm. Yeah, that makes sense. So yeah, I'll move on to the next question. How is your organization addressing human trafficking among Native youth and the communities that you work with?
This is Pauletta from Maggie's House. So this has recently become a high priority. We have received referrals from across the state. So we had to be creative and figure out how could we maneuver this such large land area and get these youth to a safe place. So we've partnered with organizations from Sioux Falls and Standing Rock Reservation, Yankton Reservation, and we're working on building some more networks with the other reservations so that we have a system in place to address the increasing level of youth being trafficked in Indian country.
This is Angela from Inda Young. I think it's the thing that is good is that now we have like words for this and that there's more of a focus on this. We have a safe harbor law that is, allowing for youth that, for minors to be treated, more as victims and in need of service and to not criminalize them when they have been engaging in survival sex or been victims of human trafficking. So our residential director is part of the Minnesota Human Trafficking Task Force and is working with several counties on protocols to develop for teams that are doing SEY for best practices for sexually exploited youth. Our staff are regularly attending safe harbor trainings that are put on through our Streetworks Collaborative, our outreach workers, which we're members of. And then our outreach workers, when they are out there, they carry basic needs supplies like safe sex supplies, harm reduction resources for youth that are engaging in survival sex and human trafficking. So we are really trying to take a harm reduction approach to it. We've also worked with a local expert to look at all of our intake materials, how we're talking about stuff, how we're asking questions so that we're hopefully getting to the root of things, that our language that we're using isn't something that is like shutting those conversations down, but instead opening up the ability of the youth to be able to talk about stuff. Routinely, the youth that we see in our transitional housing that have been victims of human trafficking or engaged in survival sex, a lot of times their initial moments when we're housing them, they're more likely to like not be coming home or to be gone for several days. And so we're really trying to take a harm reduction approach when we're working with them and making sure that like they're not getting discharged from the program because of their extended absences, et cetera. Just like really trying to figure out what we need to do to get them back engaged in the program and safe, because we know what's happening when they're gone.
Mm-hmm.
This is Gary from Bemidji again. I think a lot of it for us has been staff training, because you have to know what to look for. A lot of the youth that get involved in trafficking or exploited don't necessarily see that they're being victimized. They might have think that they found a sophisticated older person that's showing them a lot of attention and that some of their needs are being met. So the staff are trained to look for certain patterns with internet use, secretiveness, dangerous decision making, trips to other larger cities and different things. So they start to read between the lines. And then we have staff that are trained to do the guided interview to try to get a better picture, more accurate picture of what's actually going on with a person. So I think that has been real important, and we do have a safe harbor and wraparound services. The youth that are in safe harbor usually need quite a bit of nurturing to show them you're worth it, you can trust these people, they'll be there for you. And when they get that sense of stability, and some eventually the self-esteem comes up, and then you might have to put some protections in place, but they need more nurturing, more time, and it's a slower transition toward maybe more independence and independent housing, that kind of thing. So I would say those have been some of the ways that we're meeting kids' needs here.
Great, thanks everyone. So then the next question that we have are, what have been some of the issues for your organization when receiving referrals for youth that identify as Native American?
This is Angela from Ainda Young, and I can, speak from our community. So, as a culturally specific provider, like in the urban area, prior to coordinated entry starting, our partners that we worked with in youth homelessness, when they had Native youth show up in their programs, they always would contact us for referrals to our shelter and transitional housing. When coordinated entry came online, everyone was really concerned that they couldn't make referrals to programs based on someone's identity because of protected class status under fair housing. And so referrals of Native youth to our programs essentially stopped. Everything was just done on this priority list based on, who came up first, but no one was taking into account Native youth, benefiting from being in a culturally specific service, because those are services that they can't get anywhere else. We knew from other partners around the nation that had started coordinated entry earlier than Minnesota, was that once coordinated entry started, that they also had stopped receiving they hadn't received any Native referrals in the urban areas to their culturally specific programs. So we worked with some community partners, and we were really fortunate to have some pro bono legal services to really help us look at the coordinated entry mandate from HUD and fair housing. And what we realized is that coordinated entry and prioritization wasn't as black and white as how it had been being interpreted. That coordinated entry does allow for continuum of care to have a targeted response to homeless services for groups of people that are like overrepresented in their communities or in their homeless communities. So, and as you said, when we first started, like Native youth and the Native people are showing up at disproportionate rates in the homeless communities. So over the past couple of years, we worked with some attorneys and then some community partners, and we're able to have a policy adopted within our continuum that allows for targeted referrals for communities that are overrepresented in our homeless continuum. And so now youth are able to, Native youth, when they receive housing assessments and show up on the priority list, they're able to get essentially first dibs on our beds that come up as a culturally specific provider. Another issue that we've seen is when we don't have Native outreach workers, no Native youth show up on our priority list. They're not self-identifying as Native when they're showing up and at other service providers, or like outreach workers and service providers aren't getting to them in the places that they are. So it's really important for us to have Native outreach workers that can reach those youth to ensure that they're getting access to the services and access to culturally specific services.
Yeah, this is Gary. I didn't quite know what to make of this question when I first heard it, because we work with youth and they can come from self-referred family referrals, tribal workers, social workers. So we probably don't feel the impact that you're describing, which sounds more like it's a coordinated entry problem with the VI SPDAT. I think the larger problem there for us is that the HUD definition of homeless does not reflect homelessness in northern
Mhm.
Minnesota or among teens, because you couldn't survive the winter up here if you weren't able to double up or do something. So it's hard to find people that are really in living situations that are inhabitable. It just doesn't look like that. So it's a little bit different. So I'm not too sure if this one applies to us with a youth shelter.
I guess the challenge for us here in Pine Ridge at Maggie's House is, of course, space. We don't always have, like, we're at capacity now. And since I'm a 22-month program, those slots, when they become available, fill pretty fast. We have a waiting list with some students on there that are, in situations. So we try to refer them to some of the local shelters, but accessing Native youth, when we do get a referral, one of our challenges is that we never have a consistent phone number or contact info. With the use of mobile phones and cell phones, though, they're constantly changing with our clients and the youth population. And most of the time, they only have access to Wi-Fi programs or Wi-Fi phone systems. So having to be creative and maneuver through Facebook Messenger, Snapchat, Instagram, or different social media contexts that they use to maintain contact with some of the youth is one of our challenges. So I'm not sure if I was interpreting the question right, but those that would be a challenge for us as to how do we maintain these Native youth referrals. And a big part of that is partnership with the schools. And the students who have access to some of the services at the school, we have a trauma-informed grant with 3 of our local schools. So they track a lot of youth that are at risk for vulnerability to homelessness, food desert situations. So partnering with them helps us a lot with our Native youth referrals.
Great, thanks, Pauletta. I think that's a very interesting point too, reaching them through different platforms. And thanks for Angela and Gary too. We just have one last question, and then we'll open it up to attendees to ask some questions. But the last one is, what are some of the things you would like other RHY and community organizations to know in terms of who you serve and the work that you do?
This is Angela. I think that the one thing that I always say, being in an urban area, is that for programs or for people that maybe don't work with a lot of Native youth or people, and they're not necessarily sure what type of services are out there, is that you don't need to understand like every single service that's available or understand everything that goes into the work that we do or other programs do that are culturally specific, but that if you can make connections to an organization that specializes in this or provides these services, that is going to be your tool to be able to help make the connections for these youth. I kind of mentioned this in my previous response, but the Native youth that a lot of times aren't like showing up at non-Native programs, and so people don't always know in our urban communities or don't really see what homelessness looks like for Native youth in the urban area. It's kind of invisible sometimes to mainstream providers, but that these youth are showing up at our places and have been experiencing, haven't always had the best experiences when they've gone to other places, and they feel sometimes misunderstood. We've had youth that have been kicked out of programs for smudging because people think that they're, smoking marijuana in the house and all of these things. And so they're either not self-identifying or they're just not showing up because they're not sure how they're going to be treated. And so I think it's really important to be reaching out to your culturally specific providers in your area so that you can help make those connections for those youth and just to better understand their needs.
Scary. I would have a few things I'd like to mention, I think. Yeah, I've learned so much having been in Bemidji and working with Evergreen Shelter. I think one of the things that I try to talk to my staff about, because they might not have lived in Indian country and had much chance to work with Native people, is you might have to forget a little bit of what you learned in your race and minority groups relation course. So when you first meet a kid, maybe forget about culture and are you being culturally sensitive? Are you being culturally appropriate? Because you're going to get wound too tight and it's going to feel artificial. So maybe just pretend that that's your niece or your nephew and start joking around and show them a little attention, a little love. And you start to build relationships and you create kind of a climate where people feel at home and feel comfortable, and then go spend time trying to learn about all of the contributions of Native American culture to the world, politics, cuisine, all the things that are out there that are so fascinating. Get to know tradition, spirituality, ceremonies, build your cultural knowledge. But I think it's what we have in common that makes us valuable, and what we do differently makes us interesting. So I try to promote that at the shelter, and I think there's very little downtime or adjustment when people come, even from pretty remote places like north of Ponema. Maybe don't make it to Bemidji very often, but it doesn't take kids very long to feel comfortable in the house. So that is one thing. And then the other thing that I would maybe emphasize is just that trauma-informed care and the study in San Diego is such a source of optimism that all of these things that we used to think were maybe biological or genetic, that looked more disease or pathological, were really the result of experience, and they were learned so they can be unlearned. So basically, all of those things are preventable, they're treatable, and we shouldn't have any reason to feel jaded or ever think that youth can't change or that life can't get better. We should be like eternal optimists. So I think those are a couple things that I would want to leave with folks today.
This is Pauletta, and I totally agree with what both my colleagues, Angela and said about creating that culture of care. Whether they're Native youth, non-Native youth, youth know when someone is genuine and has a genuine interest, and Native youth aren't much different. But I really want to stress the fact of having that culture of care and that understanding that maybe you don't know everything about being Native, but that you want to learn and you're interested in sharing or developing resources or contacting organizations that could help that youth with their cultural identity. And with the breakdown in the family structure and how our traditional teachings and our culture and our family concept has changed, we've had to evolve with that. And so that some of us as providers have become that extended family figure to some of our youth. I've met so many youth in my work, and I've had several ask if it's okay to call me auntie or terminology like that. And of course, if you are the only adult figure in this child's life that has a care for them, they in their mental state develop these relationships based on our culture. And anyone who cares for a child and our culture, we, especially in our family, we have a, a ceremony where we make relatives. It's called the Hunka ceremony. And so our children grow up with numerous aunts and uncles that may not biologically be tied to them, but through family connections and through deeds and actions, that family and that child, they become a person of importance to them and become a relative. So I guess just being open to that concept, it's not allowing a boundary to be crossed, but in their mind, you are a care provider for them. So I guess, just like Gary said, expanding your knowledge base and what it is about their culture that makes them unique and what it is that can help them be more comfortable in your shelter or in your program or whatever, that would be my recommendation as well. And to reach out to any one of us, I'm sure we would all be willing to help you with whatever it is that you need dealing with Native youth in your organization.
Great. Thank you so much, everyone. So, also just to go off of what Pauletta said, I'll have my contact info on the next slide. If anyone has any questions for me or any of the panelists, please just shoot me an email and I can send it their way or answer anything you have about NRS and our services. So now it looks like we do have a few questions coming in. We will try to get to them all. Again, if we don't get to your question or if you have one after the fact, again, just shoot us an email. So I'm going to turn it over to Lee to read some of the questions.
Okay, so hello. So some of the questions, so Morgan Emmert asked, for those of us who are not in a shelter or residential facility and do not live near a larger reservation, how do you suggest maintaining cultural ties while working with RHY youth?
This is Pauletta. I guess one of the suggestions I would have is to reach out to your local community resources, or even if you don't have a reservation near you, like one of our organizations I'm sure would know a resource that would be available, someone near to you and could help you with either resourcing or developing something culturally appropriate or something of that matter.
Okay.
Yeah, I would also just say quick is just to do a little research and see what type of events are just in your community, because there may be so that would be a way to make connections to see if there are any like powwows or anything like that in your area, just so you can maybe get a better sense on who is in the community and help you reach out.
One of the other questions folks have is, do your agencies accept youth from out of state, and do they have to be Native American?
This is Pauletta.
And at Maggie's House, we currently have a youth from out of state. He is Native, but no, we don't have any restrictions on anyone's race, sexual orientation, anything like that. If we have a youth in need and they fit the requirements for our program, such as willing to find a job, go to school, be substance abuse free while they're here, then we're willing to try and work with them and help them be a better person if that's what they are seeking from our program.
Okay.
Yeah, this is Angela. We also serve all youth, and we do have youth that are coming from out of state as well.
A few people asked about host homes as an option. Are your organizations using that strategy, especially in rural areas that might be lacking resources?
I don't believe we have host homes in our area. I've had staff say that it takes about a year to learn really how to do this job because you get some kids with pretty high needs. Behavior management has to be an art, and it takes about a year to come in and feel like you could handle any contingency, anything that's thrown your way. So it's really important to have good staff retention so you have that, just experience that depth. And it's pretty expensive programming. So I think it's very difficult. We have to, fight to stay alive, get some help with counties and tribes for per diems, but have been lucky enough to get some federal funding for runaway and homeless youth. But you have to have, I think, quite a bit of history. I don't know. I think it'd be very difficult for host home providers. So I don't know that being rural would give them an advantage necessarily. It might actually work better in central areas.
A few people asked what factors do you see that come into play for Native youth being at higher risk of RHY? And do you have any tips or resources that you can direct people to prevent or combat these issues?
Well, Native
This
youth
is
definitely are higher risk for a variety of reasons. I usually think with Runaway, it's a combination of two things. Sometimes you're running from, if there's circumstances in your community or at home that are unsafe. But sometimes it's also running too, that sometimes kids are lured out of their bed by drug subculture connections, a variety of different things. And then, of course, those two worlds can overlap. But for me, the key is to get parents or caregivers on board and work as a team to try to find out why is this youth running away and what do we need to do to put supports, maybe some parameters, some boundaries on the thing, and try to partner until you can bring the kid into a safe situation. So we're really big on reunification and doing whatever it needs to support families and parents to make that happen.
this is Angela. I feel like it's really important to have all providers to understand historical trauma and the history of what has happened in this country to Native people, and to understand that the breakdown of families was something that was done on purpose and was systemic, and there was a purpose of that, policies historically that, and things that are still in place that impact families, and how that is passed down for the family's ability to be able to parent, and what is available in communities. And so the other thing is I think as providers, a lot of times we talk about historical trauma and trauma on our level, but that we're not always using that language when we're talking with the youth and families themselves. And so with trauma, a lot of times I think comes a lot of shame. And so we do a lot of work to educate the youth and the families that we work with on, history and historical trauma, and to try to take away some of that like personal shame, and to like realize that experiences that they had have been because of systems that have been in place, and that is on purpose. So the work that we do for, cultural healing and bringing the youth back and families back to their culture and traditions is really important in some of that healing. And the goal is to be able to do whatever we can to have reunification and preservation for families in order to prevent homelessness of youth, and to make sure that these youth have a healthy family and place to grow up.
I guess for us on the reservation, it's really hard to access safe homes, foster homes, shelter care for a lot of our Native youth who become runaway or homeless due to their family situation. And like Angela said, we have a huge breakdown in our family structure with the influx of the drugs and the meth. Meth is devastating us in Indian country, and our family dynamic is so broken in some areas that our youth are struggling themselves, and some of them are even becoming addicted with their parents, and it's creating this dynamic that is detrimental to their younger siblings. And so trying to find those resources locally and trying to encourage and create activities and situations where these youth who have no choice but to run from a situation is really challenging. So looking at working with our partners in housing and child protection to find appropriate placements is the resources that we have right now. And it may not be the best situation, but like trying to develop safe homes is our current challenge. With the Family First Prevention Act that is doing away with congregate care and group care is really going to hurt us in Indian country, because we have tried the foster home model and it has not worked. Casey family was here for years trying to do foster homes, and it just was not something that worked because we have an 85% housing shortage. So how are you going to place youth in an already overcrowded home? So looking at group care and congregate care for some of our youth in these situations is the avenue that we are looking at here in Pine Ridge.
Great, thank you. There's two questions around human trafficking. One is just if folks have a particular training or best practice that they turn to, if you could share that. And the other question is, if a client is a trafficking victim, do you help to extract them from their situation, or do they need to come to you?
This is Pauletta. So we have typically driven and picked the youth up. We immediately when we get the referral, we try to make contact with that youth and assess if they're currently in a safe situation, or is this something that we need to reach out to other organizations to try to help us get that youth in a safe situation immediately, and then provide transportation to them for wherever they need to go. So we've been fortunate that we have some excellent resources that we're able to access those youth. We've had to go and get a youth 5 hours away, but we have staff and volunteers that are willing to go that extra mile for that trafficked youth. Now, is there a best practice for us to use right now? No, there isn't one specific to Indian country, but we are using different pieces of curriculums, and we're working on developing something specific for Native youth and Native country and our outlying areas. And so, we're working with FISB and OVW to do some of this resource development. So hopefully it's something that we can look to share with you in the future.
Yeah, I would just say we're, in the process of doing that work to develop those best practices as well right now. And I think it's exciting that everyone is doing this work. Our outreach workers are trained really to identify these youth when they're out on the streets, and there's some safety protocols in terms of like when it's safe to approach youth that they are are suspecting or engaging in survival sex. And so we are the one thing is our outreach workers are really clearly identifiable, and so they're present in areas where youth, when it is safe for them, can approach our outreach workers. What we wouldn't want to do is approach a youth if potentially, their camp or someone is close by, because that could put them in danger. And so they are just trained on how to navigate that when they're on the street.
I think we're getting referrals too from parents where a parent might call real worried. My daughter just took my car and went to Duluth. And right away, we've got red flags going up. So we start asking other questions. And then you start to see that there's a pattern that looks like trafficking or exploitation. And the intervention can start there. I think if you just Googled Safe Harbor navigators, you would see a lot of good best practice information. And I think on our end, it's more about trauma-informed care and how we train to screen and detect when someone's been exploited or trafficked, and then it's the trauma-informed approach and safe harbor services to build that trust and start meeting needs until the person's self-esteem gets to a level where they're in a better place.
Okay, so we just have one last question. If we can just get one person to maybe share how they're doing things. The question is, are you incorporating college classes within the Centers for Secondary Education, GED programs, and high school diplomas?
This is Pauletta. I guess I'm lucky in that we have our local Oglala Lakota College, which is probably 3 blocks from us. And so we have several students that are enrolled in nursing classes, first-year classes, and one in the GED program. And then we also have a virtual high school through the county schools on the reservation. And we have one student enrolled in that. So we're fortunate to have resources right within walking distance for our clients.
Okay, great. Thank you, guys. Thank you for taking the time to answer all those really thoughtful questions.
My pleasure.
Thank you so much to our panelists and everyone who tuned in. If we didn't get to your question, like I said, here's my contact information. Please feel free to reach out for anything. And I will be sending a follow-up email with a copy and recording of the webinar to view and share with your network if anyone else wanted to tune in. So thank you so much.